Welcome to my virtual presentation. I'm Dr. Kibet from the Center for Open Distance and E-Learning, Machakos University. If you like my educational channel, kindly subscribe, watch, like, or even share. My topic for my presentation today is on children's nose and throat infections. Most childhood infections are transmitted through direct and indirect contact with the nose and the throat secretions of an infected person. This happens when an infected person coughs or sneezes without a tissue or handkerchief to cover their nose and mouth. It also happens when an infected person who has the virus or bacteria on their hands, after wiping their eyes or nose, coughing or sneezing, touches another person's hand or an object. It happens when viruses and bacteria remains on surfaces like doorknobs, faucets, telephones, and toys for many hours, and thereby infecting people who touch such surfaces. It happens when children touches tissues contaminated with the nose and throat secretions of an infected child. The virus or bacteria is readily transmitted to the hands of children or staff. Children who share food, utensils, drinks, sodas, bottles, and toys used by the others are likely to get infected. People who also kiss are also likely to be infected. A sore throat. The throat is a tube that carries food to the esophagus and air to the windpipe and the larynx. The technical name for the throat is the pharynx. A sore throat normally results from causes mainly related to viruses and less commonly to bacterial infection of the pharynx. A sore throat is a symptom of bacterial or viral infections, and therefore inflammation of the surrounding areas, including the tonsils, esophagus, or the larynx. One can also have a sore throat as a result of colds, flu, allergies, and strep throat. Sore throat may be accompanied by a runny nose, headache, muscle aches, and cough. Sore throats are more common among children and teenagers because young children or young people have low immunity against many viruses and bacteria. Most sore throats are not serious and are gone within 3 to 7 days without medical treatment. Over-the-counter pain relievers such as paracetamol help to clear the irritation. Sucking on lozenges, drinking lots of liquids, gargling of salt water may also ease the pain. Sore throat can develop into more serious infections if one has a weak immune system, either from HIV/AIDS or from taking such medications such as anti-rheumatic drugs, leading to such conditions as tonsillitis, infections, mononucleosis, streptococcal infections, and sinusitis. How do we prevent the spread of nose and throat infections? This can be done by the following measures. 1. Washing hands at least 5 times a day has been shown to significantly decrease the frequency of colds, flu, and other infections. Washing hands before preparing food, before feeding a child or eating, and after using the washroom or helping a child to use the washroom, and after handling pets or other animals. 3. We should also wash our hands before and after changing diapers, blowing our noses or wiping a child's nose before performing first aid, etc. Washing hands before eating or helping with food preparation, after using the washroom, after sneezing, coughing, or using a tissue, and after playing with toys shared with other children. Washing hands before and after playing at the water table, after playing outside or in the sandbox, and after handling animals or animal wastes. Use regular soap that does not contain antibacterial agents. One could also use alcohol-based hand rubs because they kill many bacteria and viruses and do not count and cause antibiotic resistance. We can also use wall dispensers and containers of alcohol-based hand rubs, which should be placed at a height that cannot be reached by small children. We can also use alcohol-based hand rubs, and we need to know that these are inflammable and should not be stored near a source of heat. Cover your mouth and nose with a tissue when you cough or sneeze. Dispose of soiled articles soiled with discharge from the nose or the mouth, vomit or feces into a disposable bin, ideally with a lid up. Thank you very much. That marks the end of my presentation, where I've been discussing about children nose and throat infections. So once again, if you like my educational videos, kindly subscribe, like, and even share. Thank you.